Dengue fever is a viral illness that's spreading at an alarming rate across tropical and subtropical regions, including Southeast Asia, Latin America, Africa, and now even parts of Europe and the southern United States. Once considered a disease limited to certain climates, dengue is now making headlines as it appears in new places, fueled by global travel and changing weather patterns. Each year, hundreds of millions of people are infected, overwhelming hospitals and healthcare systems. Cases can range from mild fever and aches to severe, life-threatening complications like dengue hemorrhagic fever and shock syndrome, putting immense pressure on families and communities. Dengue is caused by 4 closely related viruses. Getting infected by one type doesn't protect you from the others, and in fact, a second infection with a different type can be even more dangerous, increasing the risk of severe illness. The main culprits behind dengue spread are the Aedes aegypti and Aedes albopictus mosquitoes. Unlike many other mosquitoes, these species are aggressive daytime biters, making them especially difficult to avoid. Urbanization and dense populations create the perfect environment for these mosquitoes to thrive. Everyday items like flower pots, old tires, and even bottle caps can collect water, turning into hidden breeding grounds right in our neighborhoods. As cities expand and more people live close together, the risk of outbreaks grows. This makes community action, like cleaning up standing water and raising awareness, just as important as individual prevention. Dengue is no longer a distant or isolated threat. It's a global challenge that affects millions and demands urgent attention, awareness, and proactive steps from all of us. By working together, at home, in our communities, and across borders, we all play a vital role in stopping the spread of dengue and protecting our future. Dengue often begins with a sudden, very high fever that can catch you off guard, making you feel unwell almost overnight. This fever is usually one of the first signs that something is wrong, and it can be especially alarming in children and young adults. Along with the fever, you might experience a severe headache, pain behind the eyes, and intense muscle and joint pain. So intense that dengue is often called breakbone fever. These aches can make even simple movements difficult and leave you feeling exhausted. A red rash may appear on your skin, and it's common to feel nauseous or even vomit. These symptoms, along with fatigue and loss of appetite, can last for about a week, making daily activities challenging. If you live in or have recently traveled to a dengue-prone area, it's important not to ignore these warning signs. Dengue is common in tropical and subtropical regions, so be extra cautious if you've visited such places. Most people recover at home with plenty of rest and fluids, and having supportive care from family can help. However, always consult a doctor to ensure you're getting the right treatment and to monitor for any complications. In some cases, dengue can become severe. Watch for warning signs like persistent vomiting, severe abdominal pain, bleeding from the nose or gums, or difficulty breathing. These symptoms mean the illness is getting worse and needs urgent attention. Sometimes these severe symptoms appear just as the fever starts to fade, which can create a false sense of recovery. It's crucial to stay alert even if you think you're getting better. Severe dengue can lead to shock and dangerous bleeding, caused by leaky blood vessels and a drop in platelets. This can result in bruising, internal bleeding, or even organ failure if not treated quickly. Immediate medical attention is critical. Severe dengue can be life-threatening and may become fatal without prompt treatment from healthcare professionals. Recognizing the symptoms early and seeking help right away can make all the difference. Early action can save lives and prevent serious complications from dengue. Dengue isn't like the common cold or flu. It doesn't spread directly from person to person through touch, sneezing, or coughing. Instead, dengue needs a carrier, known as a vector. In this case, it's the Aedes mosquito, especially the Aedes aegypti species, which is found in many tropical and subtropical regions. When a mosquito bites someone who already has dengue, it picks up the virus while feeding on their blood. After about a week, the virus multiplies inside the mosquito, making it capable of spreading dengue to other people it bites. Just one infected mosquito can go on to bite and infect many people throughout its short life, rapidly increasing the risk of an outbreak. Aedes mosquitoes breed in clean, stagnant water found around our homes, like in flower pots, buckets, discarded tires, and even tiny puddles in bottle caps. These hidden spots are perfect for their eggs to hatch. Unlike many other mosquitoes, Aedes mosquitoes are active during the day, especially in the early morning and late afternoon. They often bite around the ankles and feet, and because they fly silently, You might not even notice them. To prevent dengue, it's crucial to break this cycle. Regularly empty and clean containers that collect water, keep your surroundings tidy, and use insecticides when needed to reduce mosquito populations. Simple steps like applying mosquito repellent, wearing long sleeves and pants, and using screens on windows can greatly reduce your risk of being bitten. Remember, fighting dengue is a shared responsibility. When communities work together to eliminate breeding sites and protect each other, we can stop dengue from spreading and keep everyone safer. The fight against dengue starts at home. Eliminate standing water weekly to stop mosquitoes from breeding. Check and empty items like flower pots, pet bowls, and gutters. Use insect repellent with DEET or picaridine, especially during early morning and late afternoon. Wear long sleeves and light-colored clothing for extra protection. Ensure windows and doors have intact screens. Use mosquito nets if needed. Air conditioning can help keep mosquitoes out. Get your neighbors involved. Community cleanups reduce breeding sites for everyone. Support local mosquito control programs for greater impact. Together, we can make our neighborhoods safer. Vaccines like Dengue are available in some countries, but mainly for people who've already had dengue. Consult a healthcare provider to see if you're eligible. Vaccination isn't for everyone. New vaccines are in development, but prevention remains essential. Vaccines are just one tool. Mosquito control and bite prevention are still crucial. No vaccine is 100% effective, and dengue has 4 virus types. Stay vigilant, use repellent, wear protective clothing, and keep your home mosquito-free. Educate your family and stay informed about local dengue risks. By combining personal action, community effort, and medical advances, we can protect ourselves and our future.